think when we think about our main dislocations, the one I really worry about is a pediatric hip dislocation, which is a relatively rare phenomenon, but unfortunately it does happen. And when this happens, it's usually a risk for articular cartilage because it's such a high mechanism of injury to force that hip out of the socket that sometimes it can actually cause a fraying of the articular cartilage on the femoral head, so the hip joint. So usually in those kids, sometimes we reduce them in the emergency department. It depends, but usually we're taking them to the operating room to make sure that they have great sedation, the muscles are relaxed as possible. And then we're usually checking a CAT scan and usually an MRI afterwards to see if any sort of cartilage was taken off and was sheared off. And then that's when I'd be sending it, to my hip preservation partners to essentially deal with. Now, a fracture through cartilage through a physis, it's pretty rare to have a dislocation through the actual growth plate. Usually how children fracture is they go through the growth plate and it usually takes off just a touch of metaphyseal bone. And what will happen is we'll reduce them and we want to watch them long term because what can occur is something called a physeal bar. So kids heal too much and they lay down too much bone, and it can actually cause very mature bone across the growth plate, which depending on the age of the child can cause that limb to grow shorter versus grow in a abnormal position, whether varus or valgus, depending on the limb involved. And that's when we have to say, depending on the age of the child, are we following this until skeletal maturity, or then are we actually going in and taking out that little piece of bar?